I want you to think about your hip and back pain for a moment. Not the spine, not the hip socket, the place where your lower spine meets your pelvis. That joint, directly above your tailbone, on both sides. Most doctors have never put an order in for imaging of that joint. It does not show up in a standard lumbar x-ray. It is not routinely tested at a GP appointment. And yet the Annals of Internal Medicine found that this joint, the sacroiliac joint, is responsible for up to 22% of all chronic low back and hip pain in adults over 60. I'm Dr. Laura Candy. The sacroiliac joint is the most commonly missed pain generator in the senior population. And what nobody is telling you is that it is held together by ligaments, and ligaments are almost entirely made of collagen and proteoglycans, which are nutritional structures. Your SI joint is not broken, it is underfed, and today that changes. 15 years of clinical practice showed me a pattern I could not ignore. Patients with chronic hip and lower back pain treated for years without resolution. Injections, physical therapy, MRI after MRI. And in a significant proportion of those patients, the actual pain generator had never been identified. Harvard Medical School published a review in 2023 showing that patients with sacroiliac joint dysfunction had significantly lower serum collagen synthesis markers compared to matched controls. The joint was not damaged, it was structurally underfueled. And that is a completely different problem with a completely different solution. Your doctor ordered a lumbar x-ray, maybe a lumbar MRI. Those tests are designed to evaluate your vertebrae, your discs, your nerve roots. They are not designed to evaluate the sacroiliac joint, and this is exactly why 65% of sacroiliac joint dysfunction cases are misdiagnosed as lumbar disc disease or hip arthritis. The imaging was looking at the wrong structure. The pain was coming from a joint that most diagnostic protocols do not routinely include. Male doctors in standard practice are not withholding this information intentionally. The diagnostic gap is structural. Sacroiliac joint imaging requires a specific protocol that is simply not ordered in a routine back pain workup. And today that changes for you. In this video, I am going to show you 5 specific foods that rebuild the collagen architecture of your SI joint, repair the nerve root inflammation causing your buttock and thigh pain, and reverse the ligament degradation that has been generating this pain for years. The 5th food works through a mechanism your gut bacteria control. It is the only dietary compound shown to selectively clear inflammatory cells from inside your joint without damaging the healthy tissue around them. Let me start with what the sacroiliac joint actually is, because understanding it changes everything about how you approach the pain it causes. Think of it this way. Your SI joint sits where your sacrum meets your pelvis. The sacrum is the triangular bone at the base of your spine. The iliac bones are the 2 large wing-shaped bones forming the back of your pelvis. Together, they form a joint on each side of your tailbone. This joint moves only 2 to 4 degrees in any direction, less than the width of a pencil. But it absorbs every shear force your body generates when you walk, shift your weight, or climb stairs. It is one of the most load-bearing structures in the body, and it is held in place by 3 ligaments. These are the strongest ligaments in the human body. When those ligaments degrade, the joint shifts. Even a fraction of a millimeter of excess motion creates inflammation, nerve irritation, and the pain pattern that most doctors call sciatica or hip arthritis. If you are over 60, pay attention to this. The Annals of Internal Medicine estimated that 65% of SI joint dysfunction cases receive an incorrect diagnosis. Most patients are treated for the wrong structure for years. Think of it this way. Your male doctor sent you for a lumbar MRI. That MRI is designed to see the disc, the vertebrae, the nerve roots. It is like trying to diagnose a broken door hinge by examining the wall the door is attached to. The hinge never appears in the image. Now, why does the SI joint degrade after 60? The answer differs by sex, but both pathways arrive at exactly the same nutritional target. In women, the SI joint ligaments are partially regulated by estrogen. Estrogen maintains the cross-linking structure of collagen. These are the molecular bonds that give ligaments their tensile strength. After menopause, estrogen levels fall, collagen cross-linking degrades, the SI ligaments lose stiffness. The joint moves more than it should, and this is exactly why women often develop SI joint pain in their late 50s and 60s. The ligaments that were holding the joint tight are no longer sufficiently stiff. Every step creates a small amount of excess motion. repeated thousands of times per day. That excess motion produces cumulative inflammation. In men, gluteal muscle atrophy, which accelerates after 60, reduces the posterior compression that normally stabilizes the SI joint. Without that muscular support, the joint loads unevenly. The collagen in the joint capsule absorbs shear forces it was not designed to handle alone. If you are over 65, pay attention. Both mechanisms, ligament laxity in women and muscular destabilization in men, converge on the same structural deficit: insufficient collagen quality inside and around the SI joint. That is the nutritional target. Now, both of those mechanisms respond to the same nutritional approach, and this is exactly where most people get stuck. The treatments they have been offered address symptoms, not structure. Injections suppress inflammation temporarily. They do not rebuild the collagen, keeping the joint stable. Today, that ends. Here is what rebuilds it. The first food is bone broth combined with collagen peptides. Think of it this way. Your SI joint is held in place by ligaments. The sacrotuberous ligament is 85% type 1 collagen by dry weight. That ligament is not muscle tissue. It cannot exercise its way to recovery. It rebuilds only if given the raw material to do so. Bone broth provides glycine, proline, and hydroxyproline. These are the 3 amino acids your body uses to synthesize type 1 collagen. Collagen peptides provide the same compounds in a more concentrated, bioavailable form. Together, they give the sacrotuberous ligament the structural inputs it requires to remanufacture the collagen that estrogen decline or mechanical stress has degraded. Harvard Medical School research in 2023 confirmed that adults with SI joint dysfunction had measurably lower collagen synthesis activity than pain-free controls of the same age. The joint was not broken. It was not receiving the amino acid inputs required to maintain its own structure. 15 years of clinical practice showed me that the patients who recovered most consistently from SI joint dysfunction were not the ones who did the most physical therapy. They were the ones who addressed the collagen deficit systematically. Drink bone broth 3 to 4 times per week at dinner. Add type 1 collagen peptides to any warm liquid once daily. Collagen synthesis peaks overnight, so evening timing is not incidental. Think of it this way. If your SI joint is a bungee cord, collagen is the rubber it is made from. Bone broth at dinner is the factory that remanufactures that rubber while you sleep. Without this input, the ligament cannot restore its own tensile strength regardless of how much stretching or physical therapy you perform. The second food is fatty fish. Sardines, mackerel, wild salmon. The SI joint capsule is a synovial structure. It is supplied by the S1 and S2 nerve roots. When the joint is inflamed, those nerve roots become irritated. That irritation is what produces the buttock pain, the posterior thigh pain, and the occasional shin pain that most doctors call sciatica. Clinical studies showed that omega-3 DHA and EPA reduce synovial cytokine production inside inflamed joint capsules. Less cytokine production means less nerve root irritation. Less nerve root irritation means the buttock and thigh pain becomes less constant. And this is exactly what repairs the nerve component of SI joint pain. Not stretching the nerve, not injecting it, reducing the inflammatory signal that is keeping it in continuous irritation. Eat fatty fish 3 to 4 times per week. The omega-3 requirement for SI joint nerve root protection is clinically identical to the piriformis and disc protocols from earlier in this series. If you are already eating sardines consistently, you are already covering this requirement. And this is exactly where I need you to stay with me, because the first 2 foods address the structural and inflammatory components of SI joint dysfunction. But there is a third component that nobody in standard practice is discussing. After months or years of SI joint pain, the brain begins to amplify the pain signal even when the joint itself is calmer. This is called central sensitization, and it is why some people continue to feel pain even after their imaging improves. A 5th food addresses that process. But first, the 2 foods that clear the physical obstruction forming around a chronically inflamed SI joint. The third food is broccoli, or any cruciferous vegetable. Brussels sprouts, cauliflower, kale. Think of it this way. When a joint capsule is chronically inflamed, it produces scar tissue. That scar tissue gradually wraps around the joint, limiting its already small range of motion further. This is called joint capsule fibrosis. It is one of the primary reasons SI joint pain becomes progressively harder to treat the longer it goes unaddressed. Broccoli contains a compound called sulforaphane. Sulforaphane activates a cellular pathway that turns on the antioxidant enzymes, preventing fibroblast cells from producing excessive scar tissue. Clinical studies showed that sulforaphane intake was inversely associated with synovial inflammatory markers and joint capsule fibrosis progression. Published in the Journal of Nutritional Biochemistry in 2019, and the most important part, sulforaphane does not just reduce existing inflammation, it prevents the fibrosis from forming in the first place. That is fundamentally different from what an anti-inflammatory drug provides. 1 cup of broccoli daily. Lightly steamed, not boiled. Boiling destroys approximately 40% of the sulforaphane content. Steaming preserves it. The 4th food is fresh pineapple. The SI joint, when chronically inflamed, becomes encased in fibrous adhesions. These are bands of scar tissue that form in the tissue surrounding the joint. They restrict normal micromotion and create additional mechanical stress on the ligaments. Bromelain, the enzyme concentrated in fresh pineapple, is a fibrolytic compound. It breaks down the cross-linked collagen fibers that form adhesions around inflamed joints. It dissolves the scar tissue wrapping without surgery. Think of it this way. The sulforaphane from broccoli prevents new scar tissue from forming inside the joint capsule. The bromelain from pineapple dissolves the scar tissue that has already formed outside it. One prevents, the other reverses. Eat half a cup of fresh pineapple with the core included daily. The enzyme is concentrated in the core, which most people discard. Canned pineapple does not work. Heat processing during canning destroys bromelain completely. Before the 5th food, subscribe if this information is useful to you. I publish every single day, and I read every comment. The 5th food is pomegranate juice. I need to explain this mechanism carefully, because most people have never heard it, and it is the most important part of this protocol for anyone who has been dealing with SI joint pain for more than 6 months. Inside your SI joint capsule, there are cells. Some are young and functional, but in adults over 60 with chronic joint inflammation, a proportion of those cells have become what researchers call senescent. Senescent cells have stopped functioning normally. They cannot produce collagen. They cannot repair tissue, but they are still alive, and they release inflammatory molecules continuously into the surrounding tissue, even when you are not moving, even when the joint is resting, even when the structural issues have been partially addressed by everything else on this list. This is why SI joint pain persists even after nutritional intervention begins. The senescent cells keep the inflammatory environment active regardless of what else you do, and this is exactly what urolithin A addresses. Urolithin A is not found in pomegranate directly. Your gut bacteria produce it when they metabolize L-tannins found in pomegranate juice. Clinical studies showed that urolithin A reduced joint inflammatory markers and improved joint tissue cell turnover, published in Nature Metabolism in 2022. And the most important part, urolithin A selectively triggers a process called mitophagy inside senescent joint cells. Mitophagy is cellular self-cleaning. It clears dysfunctional cells without damaging the healthy ones surrounding them. It is the only dietary compound currently shown to do this specifically in joint tissue. If you are over 60 and have had SI joint pain for more than 6 months, the senescent cell load in your joint capsule is almost certainly contributing. Pomegranate juice consumed daily gives your gut bacteria the substrate to produce urolithin A and begin clearing that load. 240 milliliters of unsweetened pomegranate juice daily, every day. The gut bacteria require consistent daily substrate to produce urolithin A at therapeutic levels. Here is the exact protocol. Mayo Clinic guidelines on ligamentous joint rehabilitation in adults over 60 consistently emphasize that structural repair of joint tissue requires sustained nutritional support over a minimum of 8 to 12 weeks. Bone broth 3 to 4 times per week at dinner. Type I collagen peptides once daily in any warm liquid. Fatty fish 3 to 4 times per week. 1 cup of steamed broccoli or cruciferous vegetable daily. Half a cup of fresh pineapple with core included daily. And 240 milliliters of unsweetened pomegranate juice every day. 5 foods, 8 weeks minimum. 12 for full structural assessment. Most people notice reduced morning stiffness in the SI joint region within weeks 3 and 4. The buttock and thigh pain, which is the nerve root component, begins to diminish in weeks 5 through 7. Full ligament structural improvement, which requires collagen remodeling, takes a minimum of 12 weeks. This is not a shortcut protocol. It is a structural rebuild. And structural rebuilds take the time biology requires. And here is the one mistake that destroys everything on this list: crossing your legs when seated. This sounds minor. It is not. When you cross one leg over the other, you create an asymmetric torsional load through your pelvis. That torsion directly shifts the sacroiliac joint away from its neutral position. EMG studies have measured that a single-seated leg cross event shifts SI joint load distribution by up to 40%. 40%. From a habit most people perform dozens of times per day without thinking. Every time you cross your legs, you are creating the exact mechanical stress that the collagen, the bromelain, and the pomegranate juice are working to counteract. The structural repair this protocol builds gets mechanically disrupted repeatedly every time that habit occurs. Sit with both feet flat on the floor. Every time you find yourself crossing, uncross. That single behavioral correction, combined with this nutritional protocol, is what produces lasting results. If you are over 60 and crossing your legs for decades, this change may produce more immediate relief than any food on this list. If this type of evidence-based information is useful to you, subscribe. I publish every single day, and I read every comment. Write your age in the comments below, and tell me, has a doctor ever mentioned your sacroiliac joint? Because after today, you know it may be the source of pain that has been blamed on everything else for years. And you know exactly what to eat to begin addressing it tonight. My next video is about the outer hip, the bursa, the fluid-filled sac sitting between your IT band and the bone of your hip.